Welcome, everyone. I am delighted to be here to introduce you all to this session. This session is just providing a basic introduction to the concept of what aquatic therapy is. So it's not training, it's just an awareness to give you some more information. So today's webinar, I'm going to do a little bit of an introduction. I'm going to talk about what is aquatic therapy. I'm going to talk about risk and safety considerations, benefits, and also when to refer to a specialist. So just a bit of a disclaimer, the information I'm providing today regarding aquatic therapy serves as a general guidance only, and it shouldn't replace a professional assessment. All the information and recommendations I'm going to give to you today are based on current best practice and research in occupational settings. The pictures and videos have consent to share in this awareness webinar only. Just for your awareness, during the sessions, I always have a lifeguard with present at all times when delivering any therapy in the hydropool and have appropriate training. Currently at the moment, I'm not able to support children who require physical assistance. However, we are looking into this and attending some appropriate training to help be able to offer this service, because we want to make sure we have the appropriate training to safely handle individuals in the water. Okay, so who is OT for me? I don't know if some of you know about us. If you're new, I'll give you a little bit of an introduction. We're a small team of specialist occupational therapists with postgraduate training in sensory processing, and we support children through to adulthood. We work across the lifespan. We work with a large number of children and teenagers and adults with various medical needs, and we use various OT models. And the most common model we apply to our clinical practice at the moment is the PEO model, which is the person, environment, occupation. This isn't the only model. We use very many more to help us guide to support people to participation into occupation. We're holistic practitioners. We use clinical goals to enable people to participate in meaningful activities, whether it's home, education, work, play, leisure. We use sensory intervention and assessment as well. This is another tool in our box, but it's not the only tool that we use as well. But all humans need to be productive and maintain an occupational balance. And when this balance is lost, it leads to occupational deprivation, which can result in deterioration in mental and physical well-being, as well as increased social, economic and cultural and spiritual risks. So I really like this picture and quote here. So when a flower doesn't bloom, you fix the environment in which it grows, not the flower. And as an OT, we look hugely at environment. So who am I? So to set the scene, I'm going to do an introduction. I'll be quick. I got into the health profession because I had family members who experienced significant mental health challenges and were often misunderstood. This sparked my curiosity about how health and education and social economy influence one another, and that we all are different with our own different lived experiences. I was really lucky. I have dyslexia, and I was spotted by an amazing teacher when I was at school. So I was quite young, and I also have family members. My son has ADHD and significant processing needs. So I have lived experience, but also have my clinical hat on as well. Within my professional career, I have worked for the majority of my career within the NHS in mental health and learning disability services. I worked across secure services. I worked quite a bit with the police. I've worked in mental health inpatient settings, colleges and schools, clinics, communities, universities, and more recently, a lot more workplaces as well. I support individuals across the lifespan. And I like to support individuals to reach their full potential. We support a large number of families who are neurodivergent here at OT for me. I'm very lucky because my career's given me a really wide perspective on how challenges can present at different stages of somebody's life. Like I've said earlier, I've completed postgraduate qualifications in sensory integration, which involves a real depth of study of the anatomy and the physiology behind the neuroscience. So it is complicated, and we do very, very comprehensive assessments here and intervention, all based on really good evidence-based practice, literature, research. We are always, all of us have supervision because neuroscience changes, so you constantly have to go back and look at it. I plan to do my master's degree as well for further research within sensory processing. So I'm going to move to the next slide to talk a little bit through about Aquatic. So here, I just wanted to have this quick slide. As you can see, I'm in this video delivering an ASI, so an air sensory integration therapy session in this environment. So you have to meet really strict fidelity to do this, and also I have supervision as well to ensure that I actually do meet fidelity. I'm doing what I say I do. So in this video, I've got this little boy. I'm just going to come back and then go back again, so we'll start. Here, I've got him lying in prone on a floater, and basically this is encouraging his postural support. It's getting him to lift and getting his neck extended. He's getting vestibular input from the water. He's then got his head up, and I'm increasing the challenge. So I'm getting him to square and knock down these Jenga blocks. So he's having to look. So I'm getting that ocular motor looking. I'm then increasing the challenge more, and I'm getting him to use this water pistol. So he's having to then practice motor coordination, pull the water up with the right grade of force. And then he's got to use his hand-eye coordination to then squirt and knock the Jenga blocks down. It's really important that we incorporate play and that we incorporate something really interest-based for the child and it's strength-based to get them to be successful. So here, this is a kind of a snippet of what I'm doing. It might look like I'm just playing, but I've actually really carefully scaffolded around him exactly what I'm wanting him to do to meet the goals of his therapy and what the intervention is trying to deliver for him. So that's just a snippet. So what is aquatic therapy? There are many different forms of therapy in the water. I'm sure a lot of you have heard about hydrotherapy. It's probably one of the most popular, and it's prescribed and delivered by physiotherapists. There's also Halliwick training, and this involves trainers who specialise in handling disabled people, physically disabled, safely in the water. This is often used in more specialist school provisions. Multi-system aquatic therapy is another program. I think it's 10 months, and it focuses on physical, motor and emotional swimming skills for children with autism. There's also sensory enhanced aquatics, and this is like a swimming and water safety program for children with autism. There are a number of benefits of accessing water. Water promotes play, and it helps with movement and encourages active engagement. So this is an academic citation from the Sensory Integration Theory and Practice, 3rd edition. Clinicians have said within this citation that whether they're many years of their experience, they can clearly see the children having benefits on their everyday functioning from accessing it. So there is already research showing that aquatic therapy can help children with conditions such as autism, cerebral palsy, juvenile rheumatoid arthritis, and other neuromotor challenges. However, when it comes to children with sensory integration challenges, specifically, there isn't enough scientific research to clearly prove its effects. So this means therapists often rely on their clinical experience rather than the strong research and evidence in this area. There just hasn't been the resources and the amount of access to a pool to be able to do this. I think this is probably why there's such limited research. However, Gudrun G. Singh highlights that in her chapter on aquatic therapy in the Sensory Integration and Theory and Practice, she noted both the observed benefits and the current lack of research about the impact on sensory integration challenges, therefore showing that we need to do more research around this so we can see if it does benefit or it doesn't. So what does it look like at OT for me? Currently, I'm the clinician that provides this. We're really lucky that we can hire a specialist pool at Energise, their hydrotherapy pool, to deliver this. We have very limited availability because of it being access to other members of the public. But this is typically what a session might look like with all these different tools. Looks like I'm just playing, but as I said, we're looking at kind of the tactile input, we're looking at proprioception, we're looking at the vestibular, we're looking at kind of some bilateral integration, ocular motor praxis, really dependent on that individual's assessment, what the comprehensive assessment identified, and actually what intervention can we do to help them. And a lot of the time as well, we link in not only like regulation work and development of skills, it could be working on self-care skills afterwards and looking at personal care in the shower and dressing as well afterwards. So working on those functional goals. There is like we said earlier, there is emerging research on the benefits, but it's not highly researched. The prevalence of OTs delivering this is low. And I think this is due to barriers like such as insurance, access to an appropriate hydropool, and the therapist's abilities. I know of 2 other amazing OTs in the UK who do provide this a lot more regularly. I think if you would like details of that, I can certainly share them. And they've been really helpful in providing me with some supervision and guidance when I've been looking at this as well. So when I'm in my session at the moment, applying air sensory integration, and I'm using various different pieces of equipment to ensure that I'm meeting that fidelity and meeting those functional goals of that child. And we look at proximal goals, which is the kind of sensory motor, and then we look at distal goals, which is the functional aspect that I'm trying to improve. So there's a lot of clinical considerations and risk management. This is a highly, obviously, risky intervention, but also it's incredibly beneficial as well. So I have to do a really in-depth, comprehensive risk assessment, and obviously we have a lifeguard present as well. So we have to always put safety first. So there is risk of seizures. So we always have that lifeguard present and equipment available if we need to evacuate somebody out of the pool quickly. If somebody has breathing difficulties. However, when somebody is referred and wants to, and it is deemed appropriate clinically for them to access this, we do a really thorough risk assessment. And also the Energise themselves do their own as well, to ensure that we are able to safely manage them and implement safety strategies to reduce that potential risk. There's obviously health and physical factors as well. Skin integrity is a big one, obviously, because you're going in the water. So you can have reactions to it, get rashes. If you've got an open wound, you won't be able to access it. So we have to be really, really mindful, and every week make sure that the individual who's accessing the pool hasn't had any skin integrity challenges. There's obviously risk of illness and infection of risk. Because of the temperature of the pool being higher than in an ordinary swimming pool, it can increase fatigue levels because it's very warm. It's a very warm environment. And also it can impact on your toileting needs as well. From a behavioural and sensory lens, there can be some sensory sensitivities. So I carefully monitor this throughout the session. The parent or the carer is always present on the side sometimes as well, depending on the functional goals of the child. I might ask the parent to come into the session, and we're working on something specific with the parent and the child, which is really lovely. One of the biggest challenges can be reluctance to exit the pool and present with behaviours that challenge. They're having such a great time. Why would I want to leave the pool? So again, this is part of my risk assessment. I plan transition strategies in advance. I speak to the parents. We put in a plan of action, whether we're using visual cues to help them out, we're using certain language. We might set the session in a very structured way. We need something highly motivating to exit the pool. And again, we're working together in collaboration, myself and the parent carer, to really support the child to exit the pool in the most positive way possible. So what have I observed in my time is that parents definitely are more relaxed in the water. So when I've had a parent in the water, it's a very therapeutic environment. I'm able to control the noise. It's only us in there. It's nice and warm. And I'm doing a lot of modelling with the parents in the water. It provides tactile input, so onto your skin. So water provides 30 times more pressure than air. It's warm, and it allows children to experience different tactile sensations in a safe environment. And then this can help with their dressing following after intervention. It also provides proprioception input. So that's that body awareness. So you think of your muscle spindles, it's giving resistance against that. So it's a hydrostatic, I think that's how you say it, pressure. So it improves that body awareness. You're getting more resistance against the water than you would air. So the water resistance means the individual has to apply more force in the water to move. It also gives vestibular input. So the water supports the trunk and the head. And I can then, obviously, I have floats in the water, so I can then put the child on the float, increasing that vestibular challenge when they're feeling safe and secure, and increasing that balance challenge and offering different planes of movement and grading it to ensure that child succeeds. And the different floats I'll use to improve different types of, potentially if someone's got gravitational security. Oral motor, that's another one. So blowing bubbles, breath control when going under the water, making noises under the water is a real fun one that we like to do, or when we're in the kind of dome. Smell and taste is another area. There are certain smells in the environment and tastes. Vision we use a lot, so using bright toys, as you saw in some of the pictures, to find in the water like sinkers. Supporting, and it helps that kind of searching and locating, good with hand-eye coordination, and target practice as well. We do a lot of that. Auditory, it can be loud in there. However, there is no other people and we're able to control the noise a bit. We can do underwater work if we can and safely do that. But obviously there's a risk of ear infections if we do that underwater work. Interoception is a really interesting one because I will use mindfulness in my sessions. So I might lower my vocal tone. I might kind of mirror some slow breathing to see if the child's supporting and noticing their heart rate to help with that kind of regulation, and also with the parent as well for that co-regulation. So that's all the sensory systems that we look at. It can really help attach with that child and parent bond, like that kind of sharing a joint interest, and the parent rescuing the child and making them feel safe. Guided by me within the water. We also work on self-care skills, so we link it to the occupational goals such as showering or dressing, or even accessing the community areas for a shared activity with parents. Quite a lot of families we've worked on that. Some children that we've worked with haven't been able to access community areas for various reasons, due to burnout or other reasons. And actually, by offering a really highly motivating activity with the right clinical support, we've been able to get them into the community and access something really positive, which has been one of their kind of wide independent skills. It can help with sleep. Like we've talked a little bit about co-regulation, posture massively. Vestibular influences posture, and we work on the posture when we're doing on the float work, and maybe moving between floats. I use a lot of visual aids to support children with the routine of the pool. So I might use some now and next boards, or I might use objects of reference. So there's so many things that we can apply as a therapist within the water, and I bring all my skills that I've learned over the years to do that. So yeah, that's the benefits. Okay. So that's a kind of a little bit of an awareness of what we do, what Aquatic is, and the benefits. And I hope you found that helpful. At OT for me, if you're interested, please get in touch. I have my sessions full at the moment. However, there will be some availability coming up soon. So if you give our team a call, they can let you know. If you've not had an assessment with us before, you'll need an assessment because obviously you always have to assess before you prescribe, because you need to know what's happening for that individual. So we always recommend that really comprehensive assessment to really identify what's happening for that individual. We support the whole family. We do now have adult services as well in our service and therapeutic coaching to support the parent with creating their own sensory kind of lifestyle. Also, if there's for families, if there's any families on here that are on the waiting list, if there's a cancellation in our service, we are offering last minute parent sessions for consultation. So if you're interested, just send us an email as well. But this is quite a lot of the things that we do offer. This is just some references for the literature, obviously based on what I've discussed today. So that's the references I've used. And I've had obviously mentoring and supervision from other therapists in the UK who do provide this as well. So please get in touch if we can help. Also, it's one of the things I have noticed in in aquatic therapy is I have support kids who have got hypermobile challenges as well. And the water's helped with a bit of joint pain as well when they've been in the water because of the nice warm heat and the deep pressure from the water. I forgot to mention that. But yeah, please get in touch if we can help. And if you'd like to know anything else, just book a free call or sign up to our newsletter. We try and send out as much information through our newsletters as possible to keep everyone up to date, what's happening in our service, any new changes, anything exciting. And that's me done for today. So I hope you found that helpful, and get in touch if we can help.